I'm Hamad Al-Hajji. I'm one of the Interventional Structural Cardiology Fellows here at Mayo Clinic. I'm going to discuss with you the recent article that will come out of Mayo Clinic Proceeding, the outcomes of percutaneous coronary interventions on patients with anemia presenting with acute coronary syndrome. So we know that anemia is highly prevalent in patients undergoing percutaneous interventions, and in our study we found out that 1 out of 3 patients presents for acute coronary syndrome and undergo percutaneous intervention have anemia. So prior studies showed that anemia is potential risk factors for in-hospital adverse events. However, anemia presents with significant comorbidities, and that those by themselves are responsible for those adverse events. On top of that, anemia treatment with blood transfusions have not shown better outcomes. In fact, it's been shown in the literature that blood transfusions for anemic patients is associated with increased risk of adverse events. Therefore, we tried to analyze our data at Mayo Clinic from 2004 to 2014 by studying all the patients who underwent percutaneous intervention in our institution in order to help understand the role of anemia in those patients. We performed specific statistical methods to adjust for baseline confounders by performing inverse propensity weighing method to adjust for confounders. We included around 5,668 patients in our analysis. What we found is that anemia was not associated with additional adverse events in hospital. However, over long-term follow-up, approaching 5 years, we found that anemia was associated with increased all-cause mortality, mainly driven by non-cardiac death. We also noticed that patients with anemia also have higher bleeding risk in the peri-procedural period and higher requirement for blood transfusion. Thus, these findings will help us to pay more attention to our anemic patients, potentially by performing longitudinal clinical follow-ups and establish better treatment pathways for anemic patients who present with acute coronary syndrome and undergo percutaneous intervention, especially that non-cardiac death is the main driver of long-term mortality.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.